issue that we've been talking about is how to have the person at the center of their care team, the patient and their caregiver. And also, it's not really so much person in most of the examples we talked about today, it's been a family.
Our home and community support sector is divided amongst multiple organizations, agencies, and providers.
We have too many service providers serving one family. We have multiple doors for people to go through, and it's hard for people to access.
I feel like we as funders don't talk so well to one another. I think we meet at certain tables and we have very high level conversations, but I think it's really important for us to start talking to one another more concretely.
I think that integrated teams speak different languages and often cannot communicate with one another properly. Never mind that we, the patients, understand even single-syllable words differently than you do.
Lack of communication, I find, in my case, housing staff and the clients.
What we need to clarify is what the definitions are. So what are we talking about when we talk about community?
Choppy care with our palliative patients that we're seeing in hospital and trying to transition home. Sometimes it feels like the messaging isn't getting across and the communication isn't as seamless as it could be.
Instead of telling the community support worker or the peer support worker, oh, you can handle one more. There should be a situation where they have the right to step up to the plate and say, I have X amount of clients that says this is it. This is all they can handle. So they can take the proper time with the client and get that job done more effectively.
And equitable access. You know, we're told regularly that we're not supposed to be engaging in financial conversations, but this is our reality on the ground, and it's a really challenging conversation to have with families.
There are things that are already working that we can build on. So we don't need to throw everything out to start all over again.
Let's go out into the community. Let's go to where they are.
Something we can start right away is for us to start sharing our experiences, shadowing with each other, learning more about each other's strengths so that we can actually call on each other when we need to problem solve.
I believe that it will start from yourself, having some shared informations to your neighbors.
I would start with giving myself courage and permission. Courage to ask, to say, to insist, and permission to be part of the team.
I want to leave with 2 aha moments that I can take away and start reflecting on and switching up potentially what I'm doing, or recognizing that what I'm doing actually works in this new vision.
Provide patients with their own medical information that they can keep, maintain, and share.
Sort of maybe online system, or even if it's a paper-based file that people can bring in and out of hospital with them that really shows us their care plan.
A diary for each patient, and so they can figure out what they do from a day-to-day basis. What is it that really would really help them?
Our co-design approach today, I believe, is unique in Canada and probably one of 5 in the world, where we are at every step of the process co-designing a vision to integrate home and community care in Toronto with clients and families and all the providers.
What I like about this is we're bringing all the sectors together to have conversations from different perspectives. We sit here as practitioners often, and then that suddenly somebody says, well, when my mother was in Emerge, it really sucked. We're human beings first, so we need to come at the problem as somebody with compassion.
It's an excellent facilitation exercise. You should use it across the lens.
I think it is a wonderful, fabulous, necessary idea and approach. We patients have to step up to the plate and let the caregivers recognize our experience, our own expertise.
I just love the way today is organized. I actually feel involved in something.
I think it's brilliant. I think that the only way we can really understand the sector is to get voices from every part of the sector. At the end of the day, we're not going to be able to realize this potential until we identify the potential and until we're able to start seeing what needs to be done. We need every voice around the table to identify that.
I think it's fantastic. It's about the clients and it's about what they need, and if we don't bring them to the table, then we end up designing a system that doesn't meet anybody's needs except for providers, and that's not a system, that's a collection of organizations.